Welcome back. We are back right now with the Problem Solvers Health Alert on Juul. The FDA saying the e-cigarette maker did not provide enough evidence that their products benefit public health, noting Juul may have played a disproportionate role in the rising of teen vaping. Now, joining me now to discuss the move and the dangers of teen vaping, Dr. Christian Thurstone with Denver Health. Now, I want to get right to the dangers. Can you talk about what the health concerns are for teenagers in vaping?
Sure, there are a lot of health concerns in terms of ingesting something into your lungs that's potentially not healthy. There are a lot of additives in vape. It's not just water, vapor. There's a lot of additives to make the coloring and the flavoring and everything. And we know that some of those additives are harmful for the lungs. We also know that nicotine increases pulse, blood pressure, and has significant effects on the heart. And then we also know for teenagers that they have a very precious developing brain, and that nicotine, animal studies show that nicotine changes the way the brain develops. So there are some significant issues with teen vaping.
Yeah, and they're masking it up with those sweet flavors of cotton candy and pink lemonade and stuff like that. So if you do have a Juul at home right now, do you throw it away? What do you do with it?
Yeah, so the FDA, Food and Drug Administration, ordered that Juul stop selling and marketing their products. But that doesn't mean it's illegal for people to possess or use the Juul products they already have. So they can use their products. Obviously, as a physician, I recommend that people stop smoking and stop vaping today to improve their health.
And we know that there are significant effects of vaping, as you just said. There are plenty of e-cigarette products out there. Why Juul specifically?
Yeah, so Juul is the biggest maker of electronic cigarette products, and they were one of the first players in the market for this. So this is a very big deal. And Juul also is the fourth most preferred brand for electronic cigarettes among teenagers. So this is a very big deal. We know that teenagers who vape nicotine are three times more likely to go on to use cigarettes than teens who don't use vapes. And we know that cigarette smoking is still, even today, the most preventable cause of death in the United States, causing 500,000 preventable deaths every year.
And you just mentioned teens and the numbers increasing. We know during the COVID-19 pandemic, 40%, that's what we saw in teens, a significant drop, but that's mostly because of the isolation. People are at home. We need to get that number lower.
Right. We definitely need to get that number lower. So a national survey showed that about 11% of teens are vaping every month. In Colorado, it's about 16%. And that's still too high. We know that those teens are 3 times more likely to go on to use combustible cigarettes. And we also know that 85% of teenagers who vape prefer these sweet candy flavors and dessert flavors, fruit flavors that you mentioned.
And the last thing I want to ask you, if you're a parent, how do you talk to your kids about not doing this and throwing it away?
Parents have so much influence on their kids. They may think they have no influence, but they have a ton of influence. And the single best thing they can do is to love their kids, spend time with them, listen to them, give them empathy, support, ask them, hey, what do you know about vaping? Can I tell you what I think about vaping? I think vaping is very dangerous to your health. What do you think about that?
Yeah, it all starts with those vital and important conversations.